The North Suffolk Community Health Needs Assessment is a collaborative between Revere, Chelsea, and Winthrop. The city and town leadership, nonprofit organizations, health systems, residents have all come together to make greater impact for everyone in these three communities. A community health needs assessment is a process to identify community health needs, resources, and strengths of a community in order to inform future planning. These health-related needs might be access to health care, but it can also be needs that affect health, like transportation, housing, and food insecurity.
As a healthcare provider in the region, we welcomed the opportunity to work with other healthcare providers and partners to do a community health needs assessment in the region.
Revere is the gateway to the North Shore. Our close proximity to Boston is a great asset. Population of about 55,000, 39% are foreign-born. What's great about the CHNA is it's a really resident-led process and to find solutions for the issues that are facing our city. We've been intentional about having representation from our most vulnerable populations that don't traditionally have a seat at the table.
Chelsea is the smallest city in Massachusetts. It has about 40,000 residents. Landmass is just over 2 square miles, and it has served as a gateway for many generations of immigrants. Although T&D is not a medical care provider in a technical sense, our work improves people's health. We help people have stable housing, or find stable housing, or maintain it. We help people improve their income. We help people make social connections. We help people avoid trauma and violence. We help people access healthy food and get jobs. And all of those have a huge impact on health. And the Integrated Community Health Needs Assessment allows us to confirm or find out if the priorities and the needs of the community have changed on a regular basis.
Winthrop is a beautiful seaside community close to Boston. We border East Boston as well as Revere. Population of 18,000 to around 95% white demographics. The process has validated concerns that the Winthrop Board of Health has had for some time, particularly mental health needs of our community, substance use disorders, as well as environmental concerns.
To gather data, we engaged over 2,000 individuals in these communities through a community survey that was translated into 3 different languages. We hosted focus groups, and we interviewed formal and informal leaders. We also looked at data already collected by the Department of Public Health, the U.S. Census, and the schools. Once the data were gathered and analyzed, we created a list of top health priorities. The steering committee then voted on the health needs that they felt could be addressed at a collaborative regional level and really make a difference in the residents' lives of the communities.
Hearing from our patients in the past year about housing insecurity, financial mobility, and substance use disorders. So it was no surprise to us that these areas rose to the top as areas that we could work on together.
This project so far has had a very good pace of activity and a really strong collaborative spirit. We are now ready to form some working groups to work on the highest priority issues that have emerged, and out of that will come some actionable steps which can guide all the participants in this project over the next 3 years in terms of making an impact on people's lives.